There's also a initiative to expand preschool to cover at-risk 3-year-olds as well. About $9.3 million is provided from VPI Plus slots that were unused last year, and these funds are provided to the administration to supplement any of the early childhood initiatives that may become oversubscribed as the initial implementation of the early childhood reforms begin. There's also $5 million provided, or $3.5 million provided annually for the Virginia Early Childhood Foundation to expand their pilot mixed delivery program, and another $8 million is provided to supplement recruitment and retention programs for hard-to-staff preschool classrooms. In the second year, the Federal Child Care and Development Fund, funds about $180 million, as well as the responsibility for child care licensure, will transfer from DSS to DOE, and language in the conference report would rename the Joint Subcommittee on VPI to the Joint Subcommittee on Early Childhood Care and Education, and expand the scope of that committee to provide some oversight for this transition. Moving on to lottery-funded programs, the conference report recognizes a rebound in lottery sales based on the ban of gray machines and the implementation of internet lottery sales of about $85.6 million. The conference report also provides an additional $20 million in general funds to ensure that 40% of total lottery proceeds can be reserved and dedicated to per pupil payments, totaling about $530 million over the 2 years. The supplemental lottery per pupil payments are renamed in the conference report to the Infrastructure and Operations Fund. This would ensure that $185 million is provided over the 2 years for school divisions to use on non-recurring expenses, including construction, purchasing land, school buses, as well as debt payments on construction projects. Several of these aspects were in place prior to the recession, including the minimum requirement to spend funds on non-recurring expenses, which will be set at 30% in the first year and 40% in the second year. There's also a maintenance of effort requirement to ensure that localities don't use these funds to supplant local revenue sources. And starting in the second year, the local match requirement would return as well. The conference report provides funds for several cultural and educational grant programs, including Jobs for Virginia Graduates, museums in Central Virginia, communities and schools, as well as the consolidation effort between Allegheny and Covington school divisions, and the Recovery High School that's proposed in Chesterfield County, and several others. In the central office of the Department of Education, funds are provided in the second year to support implementation of a statewide learning management system, following planning work that would occur in the first year, and about $500,000 is provided to the department to help implement bills passed during this 2020 session. And this summarizes the other language amendments throughout the budget. The first of which would provide 1 more year of staffing flexibility. The governor's budget removed this staffing flexibility language that's been in place since the recession. With this extension, the conference report also would request school divisions to provide information on how they use this flexibility. And there's also a provision that would remove the prohibition on the use of performance assessments for high school verified credits.
Good morning, Mr. Chairman and members of the committee. There's just a couple of small items in House Bill 29, just some technical ones in the middle of the page where additional reductions were taken, $3 million in administrative balances, and just an update on expenditures to date. And then at the last item, there was a reduction in the transfer to the trauma centers. It does leave $5 million for the trauma centers in 20. Going into House Bill 30, Looking at Medicaid, it does fund the forecast, as you heard earlier this session. The one largest item that was added in the conference report was $34 million for the coverage of adult dental benefits. And I think that's the greatest change right there. So I'm going to move on to the next slide. In terms of the DD waiver providers and the rate increases, personal care, there was a rate increase of 5% in the first year, 2% in the second year to help mitigate the costs of the legislation related to minimum wage. That's about $65 million over the biennium. That combined with the next item, which would provide overtime for personal care attendants up to 56 hours a week beyond the 40 hours a week. That's $19.2 million. There is the waiver refresh in two lines here, 43.4 for the group home, sponsored residential, and group day support. And then if you look down below where it says community integration and engagement providers, that also is a rate refresh for those, providing a total of about $51 million for the rate refresh. And then there was money put in for the skilled and private duty nursing of $12.5 million. Just coming down to other providers, I just want to mention briefly the psychiatric residential treatment facilities at $15.2 million over the biennium, nursing facilities at almost 14, plus with the 6 other nursing facilities below, that gives you about 16.5 total for nursing facilities. And I'll just move on to the next page unless there's any questions. In terms of DMAS and Medicaid savings, I just want to highlight a couple things here. The second line, it's a little over $40 million for the conference report, which adopts a 30-day hospital readmission policy consistent with Medicare and an emergency room utilization program. And then coming down, just House Bill 1291, I think there was a Senate Bill 5682 that saved about $8.4 million for the reduction in spread pricing for pharmacy benefit managers and the Medicaid managed care organizations. And then the conference report adopts the removal of the first-year funding for the home visiting benefit at the bottom. That does not harm the program. The program will be funded in the second year. DOJ settlement agreement, again, just at the top of the page, the only change there is recognizing the rate increases for the waiver providers, and that gives you about $68.8 million for the DOJ settlement agreement over the biennium. So let me skip to the next slide. STEP Virginia is largely unchanged. We just shaved off about $2 million in administrative costs. It still leaves the agency with positions to administer the program. In terms of community behavioral health services, this is about $92.1 million. First of all, there was a big expansion for permanent supportive housing that provides about $25.5 million over the biennium. It's almost doubling the program as it is today. There is $20 million for discharge assistance and $15 million for public-private options to divert or reduce state hospital admissions and hopefully bring the census down. And the others you've seen before, so I'm going to skip on. Behavioral health facilities, I will point out to you the first one. The conference report does phase out the temporary beds at Catawba Hospital. Entirely takes the dollars that were added in the governor's budget. It does leave them with some special revenue funds of about $5 million to phase back down to their current census, or their census before they started expanding. And in the previous slide where you saw some funding for census reduction and hospital admission and diversion, that money is going to be put in to help relieve the census pressure. So hopefully all the money that we're spending in the community will address the census. So let me skip on now to Department of Social Services. You've seen most of these, I think, just on the first slide there. I just want to point out that's a little bit less than what the House budget had for phasing in preventive service departments at local social services. Just shaves it a little bit more than the House did, but still should give them money to phase in and be successful. Going to the next slide. Just want to point out a couple things on this slide. If you go down to the middle of the page, There is about $11 million in general fund and some matching that should be non-general fund, matching non-general fund over the biennium to bring up the minimum salary for local social service workers and to provide a 1.5% increase to address salary compression. And that is in addition to the increases provided to the all states supported local employees that Michael alluded to. And then there is $1.5 million to increase the maintenance payments through TANF for two-parent families by 15%, and I'll just go over that briefly when I get to the TANF slide. And there's a little bit of money to plan the new child welfare information system, and then there are some reductions there, some backfills of administrative costs with CCDF block grant, and eliminating enterprise platform solution. That was a new item in the Department of Social Services. So going on to TANF, I'll just point out a couple of things. The conference report increases TANF benefits by 15%. That's 10% over what came in the governor's budget, so that provides you with about a little over $17 million each year. Coming down to the, you'll see calendar year 2020 summer feeding pilot program. There's money in 20 and only in 2021 to bring the summer feeding program to a one-year pilot, and we'll get an assessment of that and see how well it performs. Then community employment and training, this is a little bit less than what we had in the House budget, so it's 1.5 a year. There is continuation of the pilot project for LARCs and other contraceptives. This language on the LARCs mirrors what is in the current budget today. It does provide it $2 million each year. For the hormonal LARCs, and then there's a $1 million each year in TANF funding for other non-LARC contraceptives that are FDA approved. Community action, that's shaved a little from what the House budget was at 1.5 a year. And there's a couple things on the bottom of the slide there. Laurel Center, Lighthouse Community Center, those came over from the Senate budget and were agreed to in conference. And then, of course, we picked up the legislation that was passed this session. Department of Health, just going to highlight a couple things. In addition to the nursing preceptor program, which the House did, we also adopted the behavioral health loan repayment program. That's together, it's 2.1 each year. We picked up the legislation on the immunization of school children. And the Virginia House Bill 1015, that was Delegate Herring's bill on the Virginia Sexual and Domestic Violence Prevention Fund. That's about $1.5 million over the biennium. One thing on the adult sickle cell services, which we had in our budget, the conference report also adds a patient assistance program. It's about $1.2 million total for those items over the biennium. And then there is legislation that got picked up for the COPN program. In the next line and right after that for lead and mold testing in schools and lead testing in child daycare programs. And let me just move on here real quickly. In terms of other health and human resource items, funding for the poison control centers over the biennium stays the same. It's just done a little bit differently. General funds in the health department the first year, some general fund and non-general fund in DMAS the second year to pick up an initiative that we're allowed to do under the federal government, and it gets some federal matching dollars in there in the second year. And then we picked up the legislation on the Office of New Americans, the driver's licensing program. That was a youth commission recommendation. And then there are a number of language items here. I don't want to read through all of them. I'm just going to point out a couple. There's language requiring the HERC to do the assessment of mandated coverage of hearing aids for children by JLARC and the Bureau of Insurance prior to implementation. The cap on CSA rates for private day special education services is removed in the second year, and it requires the state to set rates. And then there is language directing DMAS to exempt live-in personal care workers from the electronic visit verification requirements, and there's money in DMAS's administrative budget to take care of that. And then finally, Mr. Chairman, the health insurance reform, there was some language modified for the State Corporation Commission related to the health benefit exchange. Just want to tell you we picked up the non-general fund that was in the fiscal impact from those bills. And then budget redirected the money for the reinsurance program and put language in instead directing the secretary to come back with a report that really looks at, to go ahead and begin the process of implementing a 1332 waiver and reports back to the General Assembly on the costs and assumptions and provides some draft legislation for you to look at next session.
Mr. Chair, members of the committee, in the area of commerce, in the economic development incentive payment accounts, 3 items to note for you. The conference report provides about $1.2 million over the biennium for the Airline Service Incentive Fund, as well as it fully restores funding for the Virginia Jobs Investment Program, and then provides an additional $2 million for the Motion Picture Opportunity Fund over the program's FY20 base budget. At the Virginia Economic Development Partnership, the conference report includes an additional $7.5 million for the Business Ready Sites program over the introduced budget. In the Department of Housing and Community Development, the conference report includes substantial investments in the Housing Trust Fund, the Virginia Telecommunications Initiative, which focuses on broadband, as well as the Go Virginia program. In aggregate, over the biennium, these 3 investments total $195 million. The conference report also retains funding for a new eviction and prevention and diversion program at DHCD with a $6.6 million investment over the biennium. The Virginia Innovation Partnership Authority will replace the Innovation Entrepreneurship Investment Authority and the Virginia Research Investment Committee. To that end, the conference report includes comprehensive reporting language for the new authority, including an annual performance report to better understand the outcomes achieved by the authority as a result of the investments by the General Assembly, and quarterly updates to the committee on the transition into the new authority. In terms of the budget, a few major points I wanted you to be aware of for the new authority. It provides $35 million over the biennium for the Commonwealth Cyber Initiative, restoring a majority of the funding for that program. The conference report includes use of $20 million from the sale of the CIT building, which is non-general funds, for smart investments in the programs included in the new authority. Bottom line, the budget for the new authority includes an additional $6.5 million in biennial funding over the introduced budget. At the Department of Labor and Industry, the conference report invests $2.3 million over the biennium for 15 positions to investigate and enforce worker policies such as minimum wage, non-payment of wages, and worker misclassification. The conference report also provides 3 positions for a new Office of Offshore Wind at the Department of Mines, Minerals, and Energy. The conference report also makes strategic investments in the Department of Small Business and Supplier Diversity to encourage and strengthen SWAM participation on state contracts.
Right, moving on to Ag and Natural Resources. For water quality improvement programs, a total of $76.3 has been deposited in the Water Quality Improvement Fund over the biennium. This includes $4.6 million each year for technical assistance funding for the soil and water conservation districts, and this has been moved to the core operating allocation provided to the districts. The conference report includes $15 million general fund the first year for the Dam Safety Fund, and language directs that the funding be used for improvements to soil and water conservation district-owned dams. For land conservation, there's a total of $11.5 million each year. This includes $10 million for the Virginia Land Conservation Foundation, $1.25 million for battlefield preservation, and $250,000 each year for farmland preservation. For DCR, funding is provided for maintenance staff and preventive maintenance needs in the state park system. Additional funding is provided for the operation of Green Pastures Recreation Area, and there's additional operating support for Mason Neck, Natural Bridge, and Pocahontas State Parks. For DEQ, a total of $18.5 million in additional resources over the biennium has been provided for additional staff and equipment to support permitting activities, as well as the department's environmental justice activities. In DHR, $5.9 million is provided the first year for the museum and cultural initiatives listed here. Additional funding is provided to establish a permanent fund to support the care and preservation of historical African American cemeteries, and the conference report restores funding for the care of Confederate graves. In VMRC, a mix of general fund and bonds has been provided for oyster replenishment and restoration. At VDAX, the largest item is the Virginia Food Access Investment Program, which receives a $1 million capitalization the first year, as well as administrative staff support. At forestry, funding's included to establish a new hardwood forest habitat program, and $400,000 each year is provided for the department's activities related to WIP 3. Moving on to public safety. For DOC, the largest items are related to inmate medical care. $27.5 million is provided over the biennium for increased hepatitis C testing and treatment costs. $9.4 million is provided for general medical inflation costs. There are a mix of general funds and non-general funds to support the department's implementation of an electronic health record system. $8.7 million is provided for UVA and VCU to operate 2 pilot programs offering medical services at 2 correctional facilities, and there's a $1 million deposit in the Corrections Special Reserve Fund. DCJS has a number of items. Most of these on this sheet, in fact, all of them were included in the introduced budget. State Police receives $3.6 million and 10 positions related to the several bills listed here, as well as $6 million over the biennium to implement the Community Policing Act. At ABC, amendments to both bills increase the general fund profit transfer by the amounts listed here. In the judiciary, sufficient funding is provided to hire an additional 100 deputy district court clerks over the biennium to begin addressing the workload issues. At the Indigent Defense Commission, funding is provided for 59 additional public defender positions across the Commonwealth, as well as to open a new public defender office in Prince William County. And at the State Bar, an additional $1.5 million is provided each year for additional civil indigent defense attorneys.
Mr. Chair, moving quickly through the area of general government, the conference report includes 3 additional positions for the Division of Human Rights in the Office of the Attorney General to implement several pieces of legislation adopted by the 2020 General Assembly. It also allows OAG to use an additional $500,000 in each year of funds collected and deposited into the Regulatory Consumer Advocacy Litigation and Enforcement Revolving Trust Fund. In the Administration Secretariat, one item to note in the Department of Elections is the conference report appropriates Virginia's Federal Help America Vote Act grant award, and it directs it towards the replacement of VERIS, the state's voter registration system. The conference report also includes several amendments for the lottery to support the implementation of iLottery, sports betting, and casino gaming. HB 29 and HB 30 extends lottery's line of credit to help them get started in implementing the provisions of gaming legislation adopted this session. In addition, HB 30 authorizes a treasury loan and directs licensing fees to support the regulatory activities of casino, gaming, and sports betting.
Moving quickly to transportation, Mr. Chairman. The budget will reflect approximately $1.2 billion in additional resources for transportation tied to the legislation that was adopted during the session, primarily the largest one being $703 million for House Bill 1414/SB 890. And the second slide just shows the language amendments, significant language amendments in transportation. Most of these amendments were included in the House budget. There were two that were in the Senate budget, but not the House. The first one being the congestion mitigation program, which would provide $5 million a year for DRPT to reduce congestion in urban areas, and the requirement that the MEI Commission be provided a detailed financing plan for the Long Bridge Rail project prior to the execution of the MOU.
And in the area of capital outlay, Mr. Chairman, on House Bill 29, there are the items that you see listed. They were already in the introduced budget, the exception probably being the School for Conflict Analysis. We were able to get $4 million of VCBA and non-general fund to complete that project. In House Bill 30, the program itself is about $3.3 billion, all funds, $86 million of general funds, mainly for maintenance reserve. There is about $1.9 billion in public building and college building authority projects. That's a $500 million reduction from the introduced budget. There's about $600 million of non-general fund projects, mainly higher education and transportation. There's about $80 million in 9C bonds. That corresponds to the House Bill 1246. Those are dorms and dining hall type projects. And then $388 million in other 90 non-general fund revenue generating projects. Again, slightly less than the introduced budget. The major projects that are in there, $701 million. There's about 20 projects in the College Building Authority pool. You see the items that are listed there below. Another $228 million for Public Building Authority pool projects. The two biggest ones are the Fine Arts Museum and the Northern Virginia Science Museum project. In other major expenses, as I mentioned, maintenance reserve, about $274 million. $65 million of that is in general fund. There are project supplements of about $171 million, $109 for the equipment, and then some of the items that are listed below. $50 million in the stormwater, and then $50 million in nutrient removal and some of the water quality improvement, and then the Alexandria Phase 2 at $25 million. Also not listed, there's about $10 million of general fund to plan about 11 projects. And then lastly, in terms of policy, there's some language related to use of balances, and then just some technical language changes.
And Mr. Chairman, the last page simply lists those items that had not been included in either the House or Senate budgets. As you can see, they're enumerated there and are all language items.
Okay, thank you, staff. Thank you very much for the briefing. We appreciate it so very much. And this concludes our time.
And Mr. Chairman, the last page simply lists those items that had not been included in either the House or Senate budgets. As you can see, they're enumerated there and are all language items.
Okay, thank you, staff. Thank you very much for the briefing. We appreciate it so very much. And this concludes our time. Thank you. We're delighted to welcome, to be with us this morning, Dr. Oliver. Will you please come forward? Yes, sir.
That way we can hear you.
Thank you. I'd like to ask for my state epidemiologist, Dr. Lillian Peak, to also join me here. We welcome this opportunity to update members of the House about the current situation around the COVID-19 pandemic and its impact on the
more people traveling from those areas that have come to the United States carrying the virus, and so we are seeing more spread now. In Virginia, as of this morning, we have 15 cases, and we have been able to, so we have more cases than yesterday because as we identify cases, we're identifying they have come from areas where we know the virus is spreading, but then they come back and they are spreading it to their household members and close contacts. So as we identify those cases, we're interviewing them to say, where have you been? Who could you have spread the virus to? And then we're working with those individuals to see if they have symptoms and test them. And this is what we do for a lot of different infectious diseases. We have these, this is a process that works well. And so we are doing that now. And that's why you're going to see the cases go up. At the same time, and that increase in cases in Europe and the Middle East and South Korea has really just started over the past 2 or 3 weeks. It's really increasing now. And so that's why we're seeing the impact now and why we didn't see it before. So we have been preparing from the very beginning. As public health professionals, we understand the risk of a novel virus. And so we have been preparing and working with partners and encouraging others to prepare from the beginning in case this happened. We have a task force in place that's multi-agency, multi-sector, and it's specifically focused on areas that we can address. First of all, the public health or the epidemiology. Being able to identify cases, test them, and do that contact tracing, and then provide public health monitoring when people are staying away, keeping people away from others when they're sick. We also have a community containment or mitigation group, and that's the group that's been working with schools and universities and businesses and getting information out to those groups so that they can begin to plan if we are in a situation when the virus is spreading. And we also have a group that's healthcare coordination. Our healthcare system does need to be able to increase its capacity to treat patients, and so we've been working with those partners to plan. And again, we're doing that with the Virginia Healthcare and Hospital Association, and we have partners from throughout the healthcare system working together. This isn't new work. We've had those healthcare coalitions in place in each region for many years now, so those partners have been coming together. A lot of these plans are already in place, and now they're saying, okay, well, how would we really implement these? We've tested, we've exercised them, but now we're getting to a situation where we will have to implement them. So there is a lot of work that's been going on. And we are continuing to expand that work and bring in more partners as this situation continues to evolve. And I do want to say that it does continue to change every day. It's a new virus. We're monitoring it. We're working with all of our partners here in the state, across the states, and also with our partners through public health globally. I'm going to stop and ask for questions.
Thank you. At this time, if we have anyone in the audience that have a question for Dr. Oliver or Dr. Peak, would you and make your questions brief. We have to be back on the floor at 11:30, so any questions, please allow them to be brief. Delegate.
Testing for people that want to get tested, how's that going to work? What are we looking at as far as the availability of tests? And what are we seeing as far as dissemination to actual doctors' offices in the Commonwealth?
So Right now, there's two ways to get tested. One is through our state public health lab, and one is through private labs. So if a person needs to go to their healthcare provider and be assessed to determine whether or not they really are at risk and have the right symptoms, and then they would get testing through the healthcare provider. So the testing capacity, because this is a new virus, it required a new test, and the tests have to be produced. So there are a lot of fronts where that's happening. So first of all, CDC is providing the materials to state labs so that they can do the testing. We are dependent on CDC to get that testing material. The amount of tests is increasing. The demand is increasing. So right now, as of this morning, our state lab believed that they had enough tests for about 500 to 600 people. And that's every time they get the materials in-house, they order more. At the same time, private labs are trying to develop their capacity, and those tests are continuing to come up, and they're continuing to expand their capabilities. And we've had discussions with LabCorp and Quest, and they are working around the clock to try to test as many specimens as they can and to expand that capacity to more of their labs. But testing is limited now, and so it is important that we do, through public health, test those who are most at risk. If we overwhelm our public health system with testing people who really don't have a risk of having been exposed, we won't be able to identify the cases, and that will lead to further spread.
Delegate Holla-Yala.
Hi, how are you? Good morning. I'm hearing that you're testing. Do you feel confident in the infrastructure that's in place in order to track and get the information on demand so that you're able to have not only identification early, but remediation or mitigation early?
So we have a system that's been in place for many years in Virginia, in every state. Infectious diseases, certain infectious diseases are reportable to the local health departments, and we track that. We're not creating new surveillance systems. So and we have electronic systems where labs electronically send the information to the local health departments, to our state health departments, so we can track that. So we do this for thousands of cases of different diseases every year. That's already in place. So that's the system that we'll be using.
And on COVID-19, we've tested somewhere around 500 to 600 people so far, right? Something like that?
I want to verify that number, but
Okay.
more.
Hundreds. We've definitely tested hundreds. We've identified 15 cases. We have the capacity to do it. And to underscore what Dr. Peak said about our readiness for that, the Trust for America's Health, a very respected organization that ranks states on their readiness, released their annual report on readiness just about a month or so ago, and we continue to rank in the top tier across the nation in that. I'm very confident in the team that we have and the ability to identify people who have the disease, do the surveillance that's necessary to do all the contact investigations, to ensure that we can do our best at containing the spread of COVID-19.
Delegate Aird.
Thank you. Is it accurate that in terms of best practice at this time, if you are found to have the virus, that you are to quarantine at home? We don't have a situation where anyone with the virus is going to be housed in our hospitals or any other facility. Is that correct?
So if somebody has, there's two technical terms: isolation if you are sick with a disease, and quarantine if you're not sick but you've been exposed. So anybody who is diagnosed to have the virus, we are definitely working with them to make sure that they're isolated. That could take place in a hospital, and hospitals do have systems in place to make sure that the person is isolated from others and they're getting the care that they need. Some of these patients, so most of the people will have mild illness, but a small proportion, up to 20%, could have severe disease, and we're going to need to care for them in our hospitals. So there are safe ways to do that. There's safe ways to isolate people in a hospital and in their homes. And we're tracking those cases as we're aware of them and making sure that they have systems in place so that they remain isolated.
Delegate Hodge.
Thank you. In looking at the spread of the actual disease and the numbers that are out there, you can't test everyone. So in looking at that, how can we be assured that when we look at the numbers and the mortality rates are accurate? Because, eventually 70% of us would probably get corona over a period of time and maybe either asymptomatic and not experience those symptoms. So how can we give folks the comfort when we look at that mortality rate and especially in the older populations, which may not be accurate?
Yeah, so a couple of things. This is a new virus, and we have to be humble to say we don't know everything about it, and we have to be vigilant about studying it. So the World Health Organization did send in a joint mission, which included somebody from CDC to Wuhan, and they published a report. We have studied that report. We've shared it with the outcomes of that report with our healthcare systems and our doctors, and so that we can learn from that. But right now, we're making our decisions based on what happened in China. But we have to continue to track the virus. We have to monitor it to see how it is affecting people in other countries. There's the scientists and physicians around the world are working together to publish information quickly. So, for example, the World Health Organization put together a group early on that modeled all this information so that we had some numbers to think about and to plan on. And now CDC has a group that's looking at all of the data and trying to understand, how many people can one person spread the virus to? What are we expecting for a case fatality rate? So it's going to change. It's a new virus, and we just have to continue to track it and change our plans as we learn more. But let me say that in the World Health Organization report of what happened in China, they said that most of the transmission was person to person by respiratory droplet. So that means your close contacts. And they also said that once they got control of the situation and they knew what was going on, most of the spread was in households in small groups. And infectious disease experts have said that it's very asymptomatic in spread. So somebody having the virus, being infected, but not knowing they had it, doesn't drive an outbreak. It is a small portion of it, but mostly outbreaks, viruses are spread when people are the sickest, they have the highest, what we call viral load, the most virus, and they're spreading it to those in close contact.
Delegate Bolivar.
Thank you, Mr. Chairman. I know a number of our school systems as well as our institutes of higher education are starting to take independent action with respect to closing down or doing online. What kind of guidance are you providing to our school systems and our institutes of higher education and other similar organizations with respect to consistency?
So the governor has a task force in place to be able to respond to this, and one of the groups is on community mitigation, and they're looking at providing guidance for different groups to contain this or to mitigate the impact in our communities. So there is guidance on our website, and the governor and others are looking more at that. So as this progresses, we need to have more specific guidance, and we'll continue to update that. But we already are working with universities and schools. We've sent out lots of information. The guidance is on our website. We are coordinating with them to provide information and to continue to work with them to inform that guidance as we continue to make it more detailed in the future.
Delegate Price.
Yes, thank you. So I had seen information about flattening the curve and trying to slow the spread. So a lot of us are going to go home, and our typical first thing is to have a public town hall. So is there a time period that would be best for us to not have public events, and also asking for those of us that may be going to conferences or large gatherings, is there something that we should be doing differently?
So as Dr. Peak mentioned, we have a multi-agency task force that we've set up to look at, among other things, how to mitigate the spread of this disease in our communities. And we are discussing all of these sort of things. I can say with confidence that there's going to be some very specific guidance coming out around that soon. We don't have it at this point, and so I can't give you a specific answer to that question, but the specific answer will be coming. I think that it's clear that at some point we are going to be looking at the necessity of thinking about curtailing mass gatherings. We'll have to have some suggestions around things like what to do with our workforce and limiting the gathering of large numbers of employees and that sort of thing. We haven't gotten there completely yet, but the guidelines are soon to come out.
Okay. Delegate, I think that's Bell.
Thanks, Chair. This is an update. We'll all scatter. Where should we be looking? Is there the website that you recommend, or Facebook? Could you tell us how to get updates?
Yes, if you go to vdh.virginia.gov, you can just go to our main page, and the first thing on there is the novel coronavirus, or you can also put /coronavirus. We are keeping that up to date, both with information about the number of people tested. We also have group-specific information, so you can go to mass gathering, large events, educational institutions, businesses. It's all laid out there, and we provide both CDC guidance, and if there isn't CDC guidance, we create VDH guidance, Virginia guidance. Or if we need to do something different in Virginia, we also create that. And just a last message that we do need to, responses to an outbreak should be local. The virus will circulate locally and in communities. And so the responses have to be in reaction to what's going on in that community. So that's just important to think about as we move forward in responding.
Dr. Oliver, Dr. Peak, thank you so very much. We're 6 minutes removed from gaveling again upstairs, so thank you. Those members who have any additional questions, I'm sure they'll be available to visit with you.
Thank you, Mr. Chair.
The House will come to order. The House will be at ease. The House will come to order. Members, please take their seats. The delegate from Alexandria, Delegate Herring.
Thank you, Madam Speaker. I believe there's a resolution at the clerk's desk, if she could report it.
Will the clerk please report the resolution?
House Joint Resolution Number 510, establishing a schedule for the conduct of business for the pre-filing period of the 2021 regular session of the General Assembly of Virginia.
The delegate from Alexandria, Delegate Herring.
Thank you, Madam. I believe that this resolution is available online on IHOD. Madam Speaker, ladies and gentlemen of the House, this resolution is something that you've seen before, but there is an additional paragraph 5. Let me refresh your memory. The resolution establishes the pre-filing procedures for the 2021 session of the General Assembly. They're the same procedures as were in House Joint Resolution Number 100, with one exception, and that is Rule 5.
Delegate Herring, do you mind if we have will the clerk please report the resolution, the entire thing?
Because this is not available online, however, we could have copies made at the back if anyone would like them. I'll read the entire resolution. Resolved by the House of Delegates, the Senate concurring that the pre-filing period of the 2021 regular session of the General Assembly shall be governed by the following rules. Rule 1, requests for drafts of any bill or joint resolution to be pre-filed shall be submitted to and received by the Division of Legislative Services no later than 5 p.m. Monday, November 30, 2020. The division shall make such drafts available for review no later than midnight Thursday, December 31st, 2020. Rule 2, requests for the drafting, redrafting, or correction of any bill or joint resolution creating or continuing a study shall be submitted to and received by the Division of Legislative Services no later than 5 p.m. Friday, January 8, 2021, in order to be filed on the first day of the 2021 regular session. Rule 3, requests for redrafts and corrections of any draft prepared for pre-filing shall be submitted to and received by the Division of Legislative Services no later than 5 p.m. Friday, January 8, 2021. The division shall make such drafts available no later than noon Tuesday, January 12, 2021. Rule 4, bills and resolutions offered for pre-filing shall be pre-filed in either house no later than 10 a.m. Wednesday, January 13, 2021. Any member offering for pre-filing a bill or joint resolution not submitted to the Division of Legislative Services for drafting is encouraged to submit an electronic version no later than 5 p.m. on the day the legislation is pre-filed. Rule 5. The rules established under this joint resolution are subject to modification or may be superseded by pre-filing rules established by the Joint Rules Committee to the extent authorized under Section 3019.3 of the Code of Virginia.
The delegate from Alexandria, Delegate Herring.
Thank you, Madam Speaker. Again, I would like to just focus on paragraph 5 because that's the addition. I will say that this comes as a result of the Senate making an amendment to the resolution requiring that draft requests be limited to 30. We rejected that suggestion or that amendment because it was vague, and I don't think it will address the Senate's concern, which is the amount of bills that are being filed and draft requests. So paragraph 5 will provide us an opportunity to meet with the Joint Rules Committee and come up with a resolution about draft requests and bill limits. As you all know, that we have a bill limit of 15, but the Senate has no bill limit yet, and perhaps that's something that they may want to consider doing. Thank you, Madam Speaker.
The delegate from Shenandoah, Delegate Gilbert.
Madam Speaker, will the delegate yield for a question?
Will the delegate yield?
I yield.
The delegate yields.
Madam Speaker, I would ask the delegate if Rule 5 essentially gives joint rules kind of a blank check on how to modify the rules existing prior, why do we continue to need Rules 1 through 4?
Delegate Herring.
Well, I think we would probably want to have rules 1 through 4 because members would know when at least they can start requesting, having their draft requests. So I hate to eliminate that. I mean, at least there's something in place. And I think it's important to have some parameters there, especially eventually if the Joint Rules Committee does meet, there's parameters that are in place and rather than starting from scratch.
Madam Speaker, further question?
Delegate Gilbert, you have the floor.
Would the delegate yield for a further
Will the delegate
question?
yield?
Yes, I yield.
The delegate yields.
Madam Speaker, I would ask though, could not the Joint Rules Committee modify Rules 1 through 4 in their entirety if they so chose?
Delegate Herring.
It's possible, yes. I would say to the gentleman, it's possible, yes, the joint rules could do that.
All right.
Delegate Gilbert.
I thank the gentlewoman.
Thank you. Madam Speaker, I
Delegate.
move the adoption of the resolution.
All those in favor of the adoption of the resolution HJ
5.
We will vote on the electronic voting board. All those in favor of HJ 510? Vote now on the electronic voting board. The clerk shall close the roll.
Ayes 54, nays 36, abstention 0.
Ayes 54, nays 36, abstention 0. HJR 510 is adopted. Will the delegate from Alexandria please communicate this action to the Senate at this time? Thank you. The House will be at ease. The delegate from Norfolk, Delegate Lindsay.
She's got it.
The delegate from Norfolk, Delegate Lindsay. The House will be at ease. The delegate from Norfolk, Delegate Lindsay.
Madam Speaker, will the clerk be instructed to report HJR 509?
The clerk will please report HJR 509.
House Joint Resolution 509, offered March 12, 2020, by Delegate Lindsay, election of a circuit court judge, a general district court judge, juvenile and domestic relations district court judges, members of the Judicial and Inquiry Review Commission, and a member of the State Corporation Commission. The resolution is on everyone's desk.
The delegate from Norfolk, Delegate Lindsay.
Madam Speaker, I move the adoption of the resolution.
All those in favor of HJR 509 shall say aye. Aye. Actually, we'll vote on the electronic voting board. HJR 509. The clerk shall close the roll.
Ayes 89, nays 0, abstention 0.
Ayes 89, nays 0, abstention 0. HJR 509 is adopted. Will the delegate from Norfolk, Delegate Lindsay, communicate the message, the actions of this body to the Senate at this time? The House will be at ease. The clerk will call the calendar.
House calendar for March 12th. On page 1, Senate Bill 1096 has gone by for the day. Senate bills with governor's recommendation, page 1, Senate Bill 3, an act to amend and reenact Section 18.2, 415 of the Code of Virginia relating to disorderly conduct students, reported from Courts of Justice.
The delegate from Newport News, Delegate Mullen.
Thank you, Madam Speaker. Madam Speaker, speaking to the bill.
Delegate Mullen, you have the floor.
Thank you, Madam Speaker. Madam Speaker, these are technical amendments made to this bill to conform to my HB 256, which we passed out last week at 67 to 25. So please check your vote, and I'd ask that it pass.
Shall the governor's recommendations be agreed to? The clerk shall close the roll.
Ayes 53, nays 37, abstentions 0.
Ayes 53, nays 37, abstentions 0. The governor's recommendations are agreed to.
Page 2, Senate Bill 791, an act to amend and reenact Sections 2.2, 4002, and other sections of the Code of Virginia relating to the management of the Menhaden fishery. There is an emergency clause.
The delegate from Fairfax, Delegate Plum.
Thank you, Madam Speaker. Madam Speaker, members of the House, Senate Bill 791 is identical to a bill that we passed earlier in the session related to the management of the Menhaden fisheries. The governor's emergency clause relates to the fact that the federal authorities have given us a deadline in June when we have to have the fisheries under management. This makes sure that we can meet that deadline rather than have to wait till July 1. Hopefully, it'll be the pleasure of the House to agree to this emergency clause, which we did on the House bill when we met last. Thank you, Madam Speaker.
Shall the governor's recommendations be agreed to? The clerk shall close the roll.
Ayes 72, nays 18, abstentions 0.
Ayes 72, nays 18, abstention 0. The governor's recommendations are agreed to.
Conference reports received. Page 2, House Bill 29, a bill to amend and reenact Chapter 854 of the 2019 Acts of Assembly, which appropriated the public revenues and provided a portion of such revenues for the 2 years ending respectively on the 30th day of June 2019 and the 30th day of June 2020, and a bill to amend and reenact Section 58.1, 638 of the Code, and to repeal the Fifth Enactment of Chapter 17 and the Fifth Enactment of Chapter 18 of the Acts of Assembly of 2019.
The delegate from Prince William, Delegate Torian.
Thank you, Madam Speaker. Madam Speaker, speaking to the conference report.
Delegate Torian, you have the floor.
Madam Speaker, this session, the Appropriations Committee worked to create a budget that would reflect the values and the needs of all Virginians. My goal as chairman were to do the following: to enhance our reserves, to support the governor's strategic investments, to increase compensation for all groups of employees, to keep higher education accessible for all Virginia's students, and lastly, to make real progress towards workforce equity. After working with the Senate conferees, we were able to resolve any differences between our two budgets while preserving the House top priorities. We are increasing access to quality education through a historic funding package. Our budget provides $79.8 million to continue tuition moderation through fiscal year 2021. Historically, black colleges and universities will receive historically high funding that was proposed in the original House budget. Our public school teachers will receive a 2% raise in both years of the biennium. K-12 education funding will be above the 2008 level, even adjusting for inflation for the first time since the Great Recession. As was the case in the original House budget, 40% of lottery funds will be distributed to local school districts as flexible per-pupil funding. Around a third of those per-pupil dollars, more than $185 million over the biennium, will be earmarked for non-recurring expenditures such as school renovations and repairs, with a floor of $200,000 per year for each school district. We're lowering the teacher to English language learners ratio and the school counselor to student ratio to provide additional support to students who need it the most. We are addressing health care equity and affordability by raising Medicaid provider reimbursement rates to preserve access to critical services such as the Developmental Disability Waiver Program and residential support living, and by establishing a state health benefit exchange to lower insurance costs. This budget also creates a Medicaid adult dental benefit and extends Medicaid coverage through 12 months postpartum. Our budget is good for business. It provides $34.5 million in 2021 and $30 million in 2022 to support Go Virginia and its efforts to promote regional economic development. It establishes the Virginia Innovation Partnership Authority to support research and startup programs. It includes an increase of $7.5 million over the introduced budget for business-ready site development. Our budget includes $70 million to expand access to critical broadband services in unserved regions of the Commonwealth. And this session has shown historical progress for labor rights and workplace equity in Virginia, which is reflected in this budget. Our budget expands workers' compensation benefits and creates a workers' compensation ombudsman. It includes 15 new positions at the Department of Labor and Industry to enforce Virginia's wage laws and protect workers. We account for the minimum wage increase, and we go beyond the governor's proposal by giving well-deserved raises and bonuses to state and state-supported local employees. This budget shores up our reserves, adding an additional $182 million above the introduced budget, bringing reserve balances to the highest point in history of the inevitable rainy day. It guards Virginia's AAA bond rating while advancing equity of opportunity across the Commonwealth. In these ways, it meets our goals for the people of Virginia. Madam Speaker, at this time, I move adoption of the conference report.
Shall the conference report be agreed to? The clerk shall close the roll.
Ayes 70, nays 20, abstentions 0.
Ayes 70, nays 20, abstentions 0. The conference report is agreed to.
Page 3 of the calendar, House Bill 30, a bill for all appropriations of the budget submitted by the Governor of Virginia in accordance with the provisions of Section 2.2-1509 of the Code of Virginia, and to provide a portion of revenues for the 2 years ending respectively on the 30th day of June 2021 and the 30th day of June 2022.
The delegate from Prince William, Delegate Torian.
Madam Speaker, I have addressed HB 30, and I move adoption of the conference report.
Shall the conference report be agreed to? The clerk shall close the roll.
Ayes 66, nays 24, abstentions 0.
Ayes 66, nays 24, abstentions 0. The conference report is agreed to. The House will be at ease as we await for the other body.
get to the opportunity for the senator from Northern Fairfax to give leadership on how we're to go into a potential second committee of conference that could reflect our values and our priorities. Mr. President, I mentioned earlier to you VRS. I've got to tell you, I am deeply concerned about VRS. We, the senator from Fairfax City and I and many of us on that committee listened to what's been happening, and thank God they have gone to more safe financing. But I've got to tell you, there's still a lot of our money that's in the markets, and that's going to be reflected in what we end up having to do as far as us setting that rate for localities, for teachers, and for our state employees. Mr. President, I know that most of you know that Virginia goes early, and Virginia goes early on everything. That means that bills we pass are often looked at as models throughout the country, and I think they will be again. There was a lot of things we did right. Once again, our budgets are normally done right, and I think this one has most things done right. But what we don't get with that luxury is we don't get the luxury of taking another month or two to see what this particular coronavirus is going to do to the economy, and as a result, going early this time is actually injurious to our ability to look around and determine what the budget should be. And make no mistake about it, this isn't just a few month budget. This covers us all the way until July 1st and then 2 years thereafter. Mr. President, I would tell you that if we vote for this budget, lose control on certain things. I think we lose our control over the items that we have made a priority in this budget. We have done certain things that have been right, and I would tell you this, that what happens from today, if we end up today voting for these two bills, we don't take a pause, what's expected to happen? One, the governor, I think, and us, we will probably go into our revenue reserve. I get that. Number two, the budget is written in such a way, as it is written now, the first thing they go after are the salary increases that we've all said we wanted to do, right? Because there is budget language that says that's kind of the first thing that drops off. I don't know if we would do that if we set our own priorities. Mr. President, after that, the governor has basically the ability to amend the budget, and I believe that what you'll have from the senator from Northern Fairfax is she'll have great influence on the governor. I'm positive of that. But after that, it's all up to the governor. The governor will make every decision as it relates to our priorities. Mr. President, I believe that the Senate budget in many ways was right. We did a remarkable job. The gentlelady from Northern Fairfax is correct, and that I think our staff did as well. But I would hope that we would recognize today that today is not Saturday, it is Thursday, and there's been a dramatic change in our economy. Mr. President, I hope I'm wrong, and if I am, it won't be the first time. I am often wrong. But I would hate to look back on this in 3 or 4 months and say that we have lost some control on our budget process and we thought we might be in that situation earlier. Once again, I'm concerned today for Virginia. I'm concerned about tourism, travel, retail, and manufacturing. That is Virginia. I'm concerned about the possibilities of some of the withholding not coming in. Mr. President, once again, I'll tell you that it does me no joy to be here. I would hope that we would have an opportunity to have one more week. If we had had that one more week, I think we could have come up with contingency funding that would have made this budget, as strong as it is, much more strong. Mr. President, I have been one that's voted for the budget when many of my colleagues have not. I'm not going to vote for the conference committee report now in 29, and I'll have a similar vote on 30, but it's not because I disagree with so much of what has been done, certainly by the conferees. It is, I think, that with another week to give our Senate leadership, our Senate chair, the opportunity to lead more and lead with that contingent funding that's so necessary. Mr. President, I know I've taken a portion of the body's time. I did, over the last couple of days, think that this was relatively important, so I wanted to share that with you. I do think that the senator from Northern Fairfax will continue to work very, very closely with the governor and others to try to identify the Senate priorities, but I just wanted to share with you what is my very deep concern about some of these items. Mr. Chairman, thank you.
Thank the Senator. For what purpose, the Senator from James City County, Senator Norman, rise. Thank you, Mr. President. I rise to associate myself with the eloquent words of the senator from Bedford.
Senator, the floor.
Picking up on his comments, he said he hoped that he was wrong about his vision. Many of you in this body know that I am frequently wrong, but seldom in doubt, and that's where I fall today. I would once again compliment the senator from Northern Fairfax County on what I consider an outstanding job on the budget, and I was very comfortable with it when I left here on Sunday, but the world has changed just a little bit. For those of you that may have a jaundiced view on the political process, let me make it abundantly clear. Whatever I say or the position I take is not some insidious or Machiavellian political move whatsoever. It is a genuine concern. And I truly believe that based upon the circumstances as we now know them with the state and national economy, it is better to move deliberately. Deliberation or being deliberate is not a synonym for fiscal conservatism, so please do not think that those are synonyms. I am concerned because I think that we're going to find a situation where non-withholding may have a little bit of a blip as people and investors continue to cash in and capture whatever remaining profits they may have, but it's going to be a precipitous fall after that, after they start setting off their losses against what remaining profits they may have. The sales taxes are going to drop dramatically. As you know, I come from the historical triangle, and we rely very, very heavily upon sales tax and admissions to Colonial Williamsburg, Jamestown, Yorktown, Busch Gardens, Water Country USA, and all the attendant ones. Before I came up this morning, I contacted the managers of 2 hotel properties that I happen to have a financial interest in. And the purpose of my call was to really see what was happening on a local level, and the response that I got is we're not getting many individual cancellations. And be mindful, we're coming up on the spring break for many elementary, middle, and high schools and the Easter season. Not getting many individual cancellations. There is a cascading of cancellations from conventions and businesses, and that is not unique just to the historic triangle. From a legal perspective, I have my team analyzing some contracts out of another resort area where conventions are attempting to cancel their conventions. So there's going to be a significant drop of revenue. To what extent that goes, we really do not know. We really do not know. So, Mr. President, without getting into a long, elaborate explanation, I'll try to keep it pretty succinct. One, I do support hitting the pause button for a brief period of time to deliberately reflect on what we are doing. And that is not a reflection on anybody because I was part of the budget process as well. In the alternative, if that approach is not embraced with great enthusiasm about moving forward deliberately, I would suggest a second approach. And that second approach would be that we put together a small bipartisan group that will send recommendations to His Excellency the Governor on contingent spending. Usually we think in terms of the governor writing an amendment, inserting preferences that he may have, or veto in certain language. This is an opportunity for us, if we choose to go on the second route, to send a very strong message to the executive branch of government that we believe some of these areas of concern that involve significant funding that can have a dramatic impact on local governments be written in a contingent fashion. So I would offer that as an alternative approach, but my enthusiasm still remains for hitting the pause button and deliberately reviewing this. Thank you, Mr. President, and I appreciate the body listening.
Thank the Senator. For what purpose is the Senator from Roanoke County, Senator Suderline, rise?
Mr. President, to speak briefly.
Senator, the floor.
Thank you, Mr. President. I obviously come from a different perspective than the senator from James City and Bedford on this particular proposal or set of proposals. I did not vote for the Senate budget, although I do think it was significantly preferable to what came from the other end of the Capitol, and I understand all the hard work that was put into it. I personally have issues with several of the tax increases that the budget's built on, the revenues there. I also have a significant issue with both the Senate budget and now the conference report, moving away from the governor's proposal on Catawba Hospital. That's something that's incredibly important for those of us in the western part of the state to provide those needed services, and so it's disappointing. But so I would have voted against the conference report had this been presented to me on Saturday, but I think that there's something very important from those of you that do embrace this approach, doing this now. I don't know how serious the actual virus is, but the economic consequences are hitting me pretty hard when I just every day get another message about how much I've lost with my rather modest portfolio, and lots of other people are getting hit a lot harder who we rely on for the tax base in this Commonwealth a lot more than we rely on people like me. But I just don't think this is something that we should be moving forward with today, even if this is an approach that you like. And so I hope the General Assembly would consider that.
What purpose is the Senator from Northern Fairfax? Senator Howell, rise.
Thank you, Mr. President. I move to speak to the amendment.
Senator's the floor.
You know, for many years, I've worked very closely with the senator from Bedford and the senator from James City County, and I have tremendous respect for their opinions. And I'm very grateful that they like my leadership. I appreciate that. But I disagree almost totally with the senator from Bedford and halfway from the senator from James City County. It's true, we are in troubling and uncertain times. We don't know what's going to happen next. There could be a quick recovery or things could get much worse very, very suddenly. But I think one of the things we should be very grateful for is that under the past Republican leadership, we established a very strong reserve fund. It's approaching $2 billion, and its whole purpose is to buffer us in uncertain times like the ones we're in now. So I don't think that there is any need for us to act precipitously. I think we're in good condition for the near future. But I do agree we need to have contingencies. I think what we should do is pass both budgets. Not doing it will send out signals that I think will be very upsetting to much of the population of Virginia. I think we need to be steady and firm at this point. And so passing the budgets will convey that message. At the same time, I do believe that the conferees need to be meeting and coming up with contingencies in case they're needed. Hopefully they won't be. But if they are, we should have them ready to give to the governor so when we get to the veto session, he can send down any adjustments to the budget that are needed. And that's what he does every year anyway. This is normal procedure. So I would hope that you will vote for both budgets and continue to have confidence in the conferees so that we can continue our work. Thank you, Mr. President.
Thanks, Senator. What purpose, Senator from Prince William County, Senator McPike, rise? No, it's okay.
Thank you, Mr. President. Pursuant to Rule 36, I'm standing on item C48.10, number 1C, but voting on House Bill 29 as a whole.
Thank the Senator. The Journal will so reflect. Do any other senators wish to be recognized? Seeing none, the question is, shall the Senator adopt Senator from Portsmouth, Senator Lucas.
Thank you, Mr. President. Mr. President, I am abstaining pursuant to Rule 36 on items 313.
Oh, Senator, I'm so sorry to interrupt. I think is that going to be pertaining to House Bill 30, I believe.
Okay, thank you.
We're just doing 29 right now. And we have others as well, so we'll come back to that. Question is, shall the Senate adopt the conference committee report regarding House Bill 29? All in favor of the motion will record their vote aye. Those opposed, no. Are the senators ready to vote? Have all the senators voted? Do any senator desire to change their vote? Clerk will close the roll.
Ayes 27, noes 11.
Ayes 27, noes 11. The Senate adopts the conference committee report.
House Bill 30.
Senator from Northern Fairfax, Senator Howe.
Thank you, Mr. President. I move we adopt the conference committee report for House Bill 30.
Thank the Senator. For what purposes? Senator from Portsmouth, Senator Lucas, right?
Thank you, Mr. President. Mr. President, I am abstaining pursuant to Rule 36 on items number 313, number 3C, and 15C, and voting on HB 30 as a whole.
Thank the Senator. The Journal will so reflect. For what purposes, Senator from James City County, Senator Norman Rives?
Thank you, Mr. President. Pursuant to Rule 36, I am going to abstain on House Bill 30, item 313, number 2C, but I will be voting on the remaining portions of the budget.
Thank the Senator. The Journal will so reflect. For what purpose is the Senator from Accomack, Sir Lewis, rise?
Mr. President, I'm abstaining pursuant to Rule 36 on item 3-1.01FF, but voting on House Bill 30 as a whole.
Thank the Senator. The Journal will so reflect. For what purpose is the Senior Senator from Richmond City, Senator McClellan, rise?
Thank you, Mr. President. I am abstaining pursuant to Rule 36 on item 114, number 2C, but voting on House Bill 30 as a whole.
Thank the Senator. The Journal will so reflect. For what purpose is the Senator from Prince William County, Senator McPike, rise?
Thank you, Mr. President. I'm abstaining pursuant to Rule 36 on items 70 as well as items 385, paragraph L, but voting on House Bill 30 as a whole.
Thank the Senator. The Journal will so reflect. For what purpose is the Senator from Eastern Fairfax, Senator Starville, rise?
Thank you, Mr. President. I am abstaining pursuant to Rule 36 on item 374.5C, but voting on HB 30 as a whole.
Thank the Senator. The Journal will so reflect. For what purpose is the Senator from Hanover, Senator McDougal, rise?
Mr. President, I am abstaining pursuant to Rule 36 on item 214G, 2C, and 4C, but voting on the budget as a whole.
Thank the Senator. The Journal will so reflect. For what purpose is the Senator from Hampton, Senator Locke, rise?
Thank you, Mr. President. I am abstaining pursuant to Rule 36 on item 303, number 2C, but voting on HB 30 as a whole.
Thank the Senator. The Journal will so reflect. For what purpose is the Senior Senator from Virginia Beach, Senator D. Steph, rise?
Mr. President, speaking to the bill.
Senator, the floor.
And Mr. President, I think that it would be very prudent for us to, as the Senator from Jamestown and the one from Bedford put it, take a pause. And Mr. President, let me tell you why I think we should do that. Mr. President, 5 days ago, if you looked at just about any stock, we'll use Boeing as an example, they were at 260, 270. 2 weeks ago, they were at 350. Today, they're down at 167. Mr. President, when we put this budget together, we based it on what we believe the financial future for the Commonwealth to be, and we did it on a short-term and long-term basis. And Mr. President, with the numerous bodies that we're hiring here, with the additional spending that we've taken both in House Bill 29 and 30, and I will say overall there are things I agree with in this budget and there are things I disagree with in this budget. But Mr. President, I think that Wall Street would understand if we took a strategic pause at this point. Let it be a week, let it be 10 days. But I think Wall Street would understand and see that Virginia was taking a fiscally prudent approach to our future. Because, Mr. President, I think in 5 days, as 5 days ago, we were much more comfortable with where we are going as a future of Virginia. I think in the next 5 to 10 days, we'll be reassured that we're going in the right direction. But, Mr. President, I think now would be a prudent time to take a strategic pause and reflect on what's happening, how our approach is going to be to what's happening, not just to what's happened here in Virginia, here in the nation and globally. I mean, we have a global response that's happening today. And, Mr. President, I think for us to vote on this today would not be the responsible thing to do, and I truly believe Wall Street would probably agree with us today. So with that, Mr. President, I hope the body would reconsider and take a strategic financial pause at this point. It doesn't hurt anything if we say we're going to come back in a week. It doesn't hurt anything if we say we'll be back in 10 days. Our schools and our jurisdictions, and we've proven this in the past, they can certainly understand and they can certainly plan if we're a week or 2 weeks late, Mr. President. Thank you very much.
What purpose does the senior senator from Fairfax, Senator Saslaw, rise?
Mr. President, there was a little story in the paper today that might have affected the price that the senior senator from Virginia Beach just mentioned. It seems yesterday that Boeing took a real minor loss that they announced of about $13 billion on the 737 MAX. I got a feeling that had just a little bit to do with their drop in stock price.
Mr. President.
What purpose is the senator from Virginia Beach
to the bill?
Rise?
I use Boeing as only one example. If you look at Apple, if you look at Tesla, if you look at GM, Ford, if you look at almost any stock, you'll see that they've taken a 30% plus hit. So I'm not isolating just down to Boeing, and every single one of those 5 days ago, it was 20% higher than it is today, 30% higher than it is today. And Mr. President, I really respect the senior senator from Fairfax, and when I give one example, please understand I can come back and give you 100 more very quickly. And if you want to talk about it, let's look at Apple stock. Let's look at Tesla. Let's look at Amazon. Let's look at Philip Morris. Let's look at Dominion. Let's continue to go down.
Mr. President, will you yield for a question?
Mr. President, I'll yield when I'm finished. And Mr. President, we have to take a holistic approach at what we do here in the Commonwealth. So when I make a suggestion that we follow the lead from our senior leaders, the gentleman from Bedford and the gentleman from Williamsburg or James City County, Mr. President, I must say that I understand when I say that, I'm looking at Wall Street as a whole, and I believe with our bond rating the way it is today, they would clearly understand that we are taking the fiscally prudent position. Now, Mr. President, I'm happy to yield to the senior senator from Fairfax.
Senator from James City County, Senator Norman.
Thank you, Mr. President. I know that we have almost completely abandoned parliamentary debate, but I would certainly be prayerful that we're not devolving down into a dueling debate on the underlying facts of it. And
thank the Senator. For what purpose is the senior senator from Fairfax, Senator Saslaw?
Would the senior senator from Virginia Beach yield for a question?
Senator Yield.
Mr. President, happy to do so.
Senator Yield, you have the floor.
I would ask the senior senator that you couldn't possibly be serious about debating Tesla stock, could you?
Senator, the floor.
Mr. President, I'd be very, very happy to debate Tesla stock, especially when Tesla came out and GM had talked about.
Point of order.
Senator, the floor.
Mr. President, it clearly is deteriorating into a running debate, sir.
Mr. President, with that, I'll sit down.
All right. Thank the Senator. For what purpose does the senator from Bedford, Senator Newman, rise?
Mr. President, speaking to the bill.
Senator, the floor.
Mr. President, I hope that this does not in any way become a Republican or Democrat thing, and I really don't believe it is. When we talked, and we don't talk about what we talk about in some of our caucuses, but I can tell you, and I may get in trouble, but we didn't ask anybody to vote anyway. We just said, listen, some of us think there's a problem, and we've got to find a way to have a solution. And that was left just like that. We also spoke about the leadership of the senior senator from Northern Fairfax, and I just I'm not going to repeat my my discussion earlier, but I do hope in regards to Senate Bill 30 that if we're going to do, and I'm sure we will, as the senator from Northern Fairfax suggested, that we get with the governor very quickly. Number two, I believe there's public information that needs to get out. I believe there's other medical items. The governor talked yesterday about the potential for about $10 million. I think that may be woefully inadequate. We have the